start this session, symposium, I'll invite Dr. Laud to say a few words about Dr. Talwalkar. Dr. Laud, please.
Co-chairman, my faculty members and colleagues, it's a special event and special emotional moment for me because in 1963, I was house surgeon Dr. Talwalkar. He died in 1985. A great person, childhood in Mumbai, and he did not attend school. I had interviewed on the television. Did matriculation with the merit. College education also with a merit. That time they used to go first class in MBBS. 1933. To Grand Medical College, JJ Hospital, left for UK in 1935. In 1936, he got his FRCS. That is his FRCS degree with a merit. He had an outstanding career. He came to this great institution, KM Hospital. Look at this building, and if you go from the right on this side, was the Ward 5. And that is Dr. Talwalkar. 1937, he went to USA to join Mayo Clinic with Lawrence Mayo. Then visited to Australia with Professor Bowler. He was so interested. He started practice at Surat. 1940, came back. He was honorary orthopedic surgeon at the KM Hospital. He did the first SP pin in KM Hospital, Ward 5. You see his portable machine and Watson Jones's table. And he did a pinning for the transcervical fracture. Dr. Vora is there, he will remember. That is his ward where we all worked. 70 patients, 70 beds, but 140 patients. I was an externee, 4 hours in the morning, and worked with him. So he believed, and I believed he's the father of trauma surgery and a great innovator. He believed in internal fixation, external, intra and intramedullary that time, 1960, because he said early mobilization give functional recovery, pain relief, mobile joints, and reduce incidence of neuron malunion. He invented a square nail principle, first endoprosthetic replacement in 1963, pioneer in designing and manufacturing implants, instruments in India, because every surgeon could afford those. That time you had to import the instrument, which was very expensive. Also for failure, what we are talking about, intertrochanteric fracture, he modified the SP nail with a clip, I'll show you, and then Talwalkar bypass. And that says both implants produced here, monoblock Jowett nail, and Dr. Talwalkar's nail, 2 fragment or even subtrochanteric fracture full union. So he believed that you must reduce, get stability, put them on together, do not disturb the environment, let the body do the rest, art of surgery be propagated and promoted. And he published his first on square nail. And I feel, my friends, when I saw tense nail, I was talking to Dr. Tanna, why don't we use a square nail? It's a better principle. So he also believed and put a V nail for tibia. And he said to get a stability, not only put a V nail and reduce it, stack it. So, and I was just left, Dr. Bora will remember, in 1963, he did this first Austin-Moore prosthesis. So he was very dedicated to his life to promote education, entrepreneurship, documentation, promotion, and partnership. And he was always very, very proud of his wife because he had 3 children. He adored 2 people, Dr. R.J. Katrak and with Muhammad Padhyay, P.V. Kane, one of the intellectuals in literature. 3 children of MCH, Dr. Talwalkar, his son Chitranjan, and his Chitranjan's son. So, he was not only in orthopedics, but he was a great teacher and had a very rare humor. He believed in good things of life, car, clothes, comforts, and company. A keen worker and astute observer. BOS meeting, he used to write his notes and ask the surgeons next time what has happened. So he was a prime mover to start MS Orthopedics in Mumbai University. B.B. Joshi was the first MS postgraduate. He was promoter of Indian Orthopedic Association, Bombay Orthopedic Society, started BOS bi-monthly meeting and Sunday half-a-day lunch. After that, the president was supposed to buy a bottle of gin. And we would go to lunch and put together. Right from Dr. Talwalkar Dholakia to all my district friends sitting here, we enjoyed that. He started the concept of regional conference, YROC, where he believed the states of Gujarat, Madhya Pradesh, Karnataka, Goa and Rajasthan. And YROC meetings were promoted to education to distant part of the Western world. He didn't stop at that. He started JJ Fellows in 1961, and we're still continuing. And first fellows were distinguished Dr. K.V. Chaubal, M.T. Mehta of Ahmedabad, and A.K. Das of Calcutta. He also started E-Mark Fellowship for young trainee surgeons. He was a great observer, one of the best documentation what are known as green card. He had 30 years record, which he used to write with his hand. And he maintained that for 30 years. Friends, just understand how fortunate I was, and look at these names, and you remember them. Honorary Chief of Dr. Talwalkar, first Honorary Assessor Professor Vora, who is very much here. Dr. Emin Shane was no more, that's Dr. Shane's picture, and he was his great student. Dr. S.D. Mehta was no more, he was triple FRCS as a registrar, and K. Sancheti of Pune was second registrar. His houseman was his son, Y.R. Kher, who became Professor Emeritus in Surgery, and Dr. R.L. Thatte, who is one of pioneering plastic surgeons and as an externee. Friends, it has been distinguished and grateful life I spent with all these men. I thank you.